Yeah, hello everyone. I'm Joji Philip, the founder and editor-in-chief at DealStreetAsia. Welcome to our webinar and thank you for joining us. Let me just start with a few housekeeping notes. This session will be recorded and both the video and the transcript will be published next week. You'll also all subscribers will get both the video and the transcript on their emails too. We will try and take a few questions at the end. So please submit your questions via the Zoom's Q&A function, and we'll perhaps save the last 5 minutes for an audience Q&A. This is the second in our series of webinars, and that we are hosting all the way to December. And it's also a subject that I'm sure has great personal resonance with many of you. Two quick points again before we start. Our next webinar is on November 30, and you can see the details on the screen. The second is at Deal Street Asia, we are bringing back our Jakarta event next year. That's on March 8 and 9. And now let's sort of move on to our subject for the day, which is building healthcare solutions for a post-pandemic India. All of us had a ringside view of the devastation brought about by the second wave of the COVID-19 pandemic. And many of us were been unfortunately had to, new first degree connections or like experience loss firsthand. This has also brought into sharp focus the need for a completely different approach for healthcare in India, since the old system has proven to be quite inadequate when faced with a public health emergency like we had over the last few months. Predictably enough, there's been an increased interest in health tech and insurance. As one of our speakers today, Aniruddha Sen, co-founder at Kenko, had told us earlier, he was of the view that medical expenses that are unaccounted for by the insurance industry stands at about $380 billion just in India alone. Outpatient expenses, that's expenses that are not related to hospitalization, they cornered about $300 billion, and there's no structured financing options to pay for these, especially after the pandemic, which, apart from its impact on health, also seriously dented the wealth of those impacted. Many in India's middle class have realized that they're financially in a very difficult position than they have been than they previously assumed. So today we're going to be discussing the role of private capital investments and how it can play a role in providing healthcare solutions that go beyond what is currently covered by the traditional insurance players. We're also going to be looking at health tech. We're looking at mental health, which is a rarely discussed subject, and how mental health has been brought into a sharp focus by the pandemic. And we'll also take a look at the regulatory scenario in India. And to discuss all of these, I'm joined by a set of very eminent panelists who are the best placed to sort of share their insights here. Our panelists today are Ben Matthias. He's the managing partner, Vertex Ventures, Southeast Asia and India, among the largest VCs that do both regions. I'm also joined by Ruchira Shukla. She's the regional lead, South Asia Disruptive Technologies, Direct Investing and VC Funds. She's also the global sector lead for health tech at the International Finance Corporation, the World Bank Group. Abhishek Mohan also joins us as a speaker today. He's a principal at Sequoia, India. And finally, we have Anirudh, who had mentioned earlier. He's a co-founder of Kenko Health. So just to begin with, I'm going to ask each of our panelists, just maybe take 30 seconds to give a brief introduction about themselves and their firm. May I ask, Abhishek, you want to go first?
Sure, happy to do that. Thanks, Shoji. So I'm Abhishek Mohan. I'm a principal in the venture fund at Sequoia Capital. Uh, Sequoia Capital has been in India for 15 years. We are a very traditional venture capital firm investing in tech startups. Uh, as I said, the franchisee has been in India for the last 15 years. We are super active across all stages of investing, be it seed stage, venture stage, and growth stage, and across all sectors. And relevant for this conversation, we have been, over the last few years, we have been super excited about health and insurtech. making investments both in India and Southeast Asia. Some of them being Turtle Mint back in the day, and then more recently Plum, which is an insurance distribution company, Pristine, which is a healthcare services company, Koala in Southeast Asia, which is again an insurance distribution company. So yeah, we have been super excited about this whole healthcare and insurance tech space, and have been actively investing in this space both in India and Southeast Asia.
Thanks, Abhishek. Ruchira, please, you want to go next?
Sure. So Ruchira Shukla and I represent International Finance Corporation, the IFC, which is part of the World Bank Group. IFC is the private sector arm of the World Bank Group, which means that we do investment in private enterprises. IFC has been investing in emerging markets for almost 6 decades, and between our traditional investing, which includes infrastructure, manufacturing, agriculture, financial services, telecom, and technology, collectively, we've been investing close to $30 billion globally every year, and about 6 to 7 million of them, or 6.
I think we've lost her, lost Ruchira. We'll just wait for her to come back. Ben, you want to go next?
Sure. My name is Ben Matthias. I'm with Vertex Ventures. Vertex is a global network of funds headquartered out of Singapore. And I'm a managing partner in the Southeast Asia and India Fund, which invests in Southeast Asia and India, based in Bangalore. And we have been very active, one of the most active and experienced funds in the region. Been investing for more than 20 years now. And in India, we've got a large portfolio of both healthcare as well as non-healthcare portfolio companies. Some of the companies we've invested in this sector in India, IU Health and IVF Access. We're also investors in Sunday, which is a Thailand-based insurtech company. And we've got a couple of other companies in the pipeline in the healthcare and insurance space. My background personally, been a VC for 15 years in India. And before that, I was a software professional in Silicon Valley.
Yeah. Anirudh?
Hi, morning, afternoon to those in Singapore. So my colleague Dheeraj and I, we're co-founders at Kenko. Both of us have worked in health insurance for about 12 to 15 years apiece. And Dheeraj and I, we were colleagues at a company which we joined fairly early. It's a company called Cigna. They were setting up in India. And while we were working there, that's where we got the first ideas around Kenko. Essentially, what we do is we create financing solutions across OPD as well as IPD in conjunction with insurance companies. Our focus is on outpatient expenses, creating financial products for outpatient expenses. And our target audience is very squarely the missing middle, so middle income families in India.
Yeah, thanks everyone for the introductions. Let me just start with a couple of big question, big picture question, just to set the context. Abhishek, let me start with you first. As one of the largest investors across Southeast Asia and India, for sectors such as health tech, insurtech, how much has the pandemic sort of added fuel to the fire? Has deal volumes and investments gone up significantly, and what has changed on the ground over the last maybe 18 months?
Sure. So Joji, the answer is yes, absolutely. The deal volume and activity has increased, and it's all sort of related. So basically, with COVID, there was acceleration of digital adoption of services and products. As we reflect on our own behavior, I'm sure we can associate that with that sort of change. Most companies saw tailwinds during this whole pandemic period, and the good thing is, even as now the pandemic is slightly subsiding in India and Southeast Asia, that momentum has sustained. It's not that the people who tried it during the pandemic or at the peak of the pandemic have sort of left and gone back to the old behavior. They're sticking to that digital first behavior. So most companies are benefited. Specifically in health and insurance, again, we saw very similar sort of acceleration. On the health side, the online consultation sort of shot up significantly. On the insurance side, in general, there has been a 40% year-on-year growth of premium collected, right? And so all of it sort of trickle down to the startups and the tech companies which are in that whole space. All of this then eventually led more private sort of capital to flow into these companies, which led more founders who were sitting on the fence and had ideas to sort of jump onto the whole startup ecosystem. So in a way, it's all connected, but because of existing companies seeing acceleration, more capital flowing into these companies led to more founders coming into the space and launching innovative products. So it has led to increased deal activity. Over the last 12 months, we have seen the most amount of companies emerging in health and insurtech, and hopefully this will sustain, and we'll find new, more innovative companies coming up.
Yeah. Ben, related to what Abhishek said, you've been a VC for, you said, about 15 years, and you've seen the startup boom that both India and even, like, for example, Southeast Asia has had over the last maybe 2-3 years, which is, but why hasn't, health tech or insurtech startups scaled in line with the boom that we have sort of witnessed for the other sectors?
Good question, Georgie. So healthcare, first of all, can never be a tech-only business. There is a very large offline component in healthcare. You cannot only get your healthcare needs provided for by an app or by talking to a doctor on video. You have to be able to go into a hospital and you have to be able to meet the doctor face to face. So inherently there is a scalability challenge, and that cannot be wished away. So, and this challenge got even more during the lockdown period. A lot of healthcare startups that were looking to build offline centers had to slow down their process because they couldn't travel. Now, what we are seeing here is a lot of offline hospitals, healthcare chains are now working with startups to tech enable themselves, to make themselves more accessible. So you can get healthcare consultations even if you're not in the vicinity of the hospital. But that doesn't take away from the fact that you still need the hospital, you need the clinic, you need the doctor. And those are constraints that will limit your scalability and your pace of expansion. Now, insurance is a completely different thing. I think insurance, there is a limitation as far as the regulator is concerned. And we can talk a little bit more about this. I think there are changes that need to happen there in order for health insurance to scale faster. There is the capital that's available, there are entrepreneurs available, but there is a regulatory challenge that needs to be addressed.
Ben, a quick question to you: like, what do you see similarities and differences between, say, India and Southeast Asia for these sectors?
I think similarities of there is a demand supply gap. There are people that you take away Singapore, but if you take most of the other Southeast Asian countries, there is a big demand for healthcare. There are healthcare professionals available to address it, but they're not necessarily in the same city as same location as where the demand is. So yes, you do need to bridge that gap with technology, and that needs to be addressed. But at the same time, there is a limit to how quickly you can scale.
Got it. Anirudh, what's the scene in India right now when it comes to sort of affordable and accessible healthcare, and what has changed due to the pandemic?
Two parts to your question. What is the scene right now, and has the pandemic affected that? So first part of the question, there are two keywords, affordable and accessible. If you look at cost of healthcare and compare it to other countries on a per capita basis or even on a whole population basis, healthcare costs a lot lesser than in perhaps much more developed countries. Multiple reasons for that. Healthcare, some elements of healthcare are subsidized by the government in India, and it has been because of our socialist past and what was done in the 60s and 70s. Accessibility continues to remain a problem. So we do have a population pressure. the number of healthcare facilities per capita available is far less than what is required. Now, coming to the second part of your question, has the pandemic affected this? Not to any sizable proportion. So the pandemic has only been around for 12 to 13 months. To expect that a pandemic can completely change the fundamental makeup of how much healthcare costs and how widely it is available within a 12 to 13 month period is a little, it's difficult to do. But what it certainly has done is it's done two things broadly. One, it has heightened the sensitivity of people for things like structured financing for healthcare. And second, it has also amplified the cracks that we have in our healthcare system. So beds not being available, suddenly all of us running out of medical oxygen and then costs going through the roof. These are all cracks that were always there. But because of the sudden pressure that came in the second wave over just 2 weeks, those have got amplified. And whenever something like this gets amplified at a nationwide level, it brings that problem right to the fore of policymakers. So as a result of that, you should expect to see a whole bunch of policy changes, and therefore following that up, some infrastructural changes which will happen over the next two to 3 years or so.
Sure, thanks. Now that we have the context, just want to kick off the discussions with the last part that you said, Anirudh, in terms of the policy changes, what is required, the regulatory changes. Ben, let me start with you. When it comes to Vertex, you have done, for example, insurtech deals in Southeast Asia, but the last 1 or 2 years you've shied away from doing any such deals in India. Are the regulatory challenges such a big concern that a large fund like Vertex is not touching the space in India? And can you tell our audience, what are the challenges that the sector faces?
Well, it's not that we've not wanted to do any insurtech investments in India. We've tried, but there has been a challenge from the regulator. And I'll be quite blunt about this. We've had companies, startups that were funded by very strong entrepreneurs with lots of years of experience. There's been capital lined up for these companies, but the regulator just doesn't make a decision. And it's fairly opaque in terms of why the decision was not made. And at the end of the day, if you cannot get a license, you cannot operate. And what is needed, the need of the day in India right now is innovative companies to come up with new products, with new healthcare insurance products. And for that, they need the license. And for that license to be given, the regulator needs to be a lot more proactive, a lot more open-minded about new models and new models that address the need in this country. And that's the challenge we've been facing. And I was very happy to hear Anirudh's prediction that a lot of policy will come up in the next couple of years, because I think that is gravely needed in this country right now.
Yeah. Anirudh, before you take that question, answer to question from Ben, just want to add one more thing. I just want to look at a recent example, and this is not just related to your sector, but across any startup in India that had a subscription business. The two back-to-back rules issued by the Reserve Bank of India that have left all businesses, banks, fintech, startups, everything. The whole payment system wasn't prepared for the October 1 deadline for the new rules on recurring payments. And now some reports from India say that 70% of all standing instructions for recurring payments have failed in October, and they continue to fail, hurting businesses big time. How much has this hurt a company like Kenko, and what's the road ahead here?
So, sure, I mean, it has hurt us just as much as it has hurt other people. Thankfully, we haven't yet reached that scale where it becomes mission critical for us. So this thing came out in March. It gave us some time to prepare. Having said that, it takes a little bit of time to build up the infrastructure to tackle a problem like this. So some remnants of the problem are still there. Now, if you break it down, the problem, there are two facets to the problem. One is collection, and the other one, perhaps even more important, is in communication. So before someone's mandate comes up for a particular month, you need to let them know or remind them that their payment is coming up. But the RBI's guideline date was that it put the onus of this communication onto banks and financial institutions. Now, they were totally unprepared. They don't have the kind of infrastructure that is required to do this, at least, not at such a short time period. So as a result of which, people like us had to build out our own communication stack. We still depend on payment services companies for collecting money. There, we're still seeing that quite a lot of the banks haven't yet formulated a kind of a uniform system in order to collect these payments. There are two private stacks that are currently operating. So we're working with our payment services companies. The uptake on that is going to take some time. What I do understand is that there is one more which is going to come, perhaps by the end of this year or maybe the end of the next quarter, where any merchant will not be allowed to store card details. So what that does is that it's going to have a massive secondary impact. What it means is that every customer will then have to, for every single transaction, put in their card number, which was otherwise safe. So people like Amazon, etc., which have large volumes of these electronic transactions going on, they had built a whole lot of solutions around simplifying all the friction at the point of payment. Now, all that has to be rethought. So whenever stuff like this happens, it comes as a shock to the system. The system takes about 6 to 8 months to recover from that shock. And then there is another 8 to 10 month period when you're on a recovery mode, and then transactions have to come back to what it was so you're looking at a year, maybe a little over a year before things get to normalcy.
Abhishek, let me come to you. Just a related question. You mentioned earlier how Sequoia has been super active across some of these sectors. And from an investor's perspective, like, how do you see India's plans to build a digital backbone for healthcare? The National Health Authority is building a unified health interface, or UHI, and that'll help connect patients and healthcare service providers. It'll aid them in discovery, payments, access to healthcare service across different apps. It'll also sort of digitize and standardize patient health records to ensure easy access and interoperability. So will this be a big game changer, just like UPI was for payments?
Yeah, Jody. I mean, the way currently the UHI is envisaged, it can be quite revolutionary. I'd say it's an open network which will get everyone on the same platform, be it the patient, the provider, or the payer, right? Which are the three most important elements of healthcare system. And just like UPI digitized the whole payments industry, and as a result created a whole ecosystem of companies emerging around UPI, UHI definitely has the potential to be as big and as disruptive. Of course, health and insurance combined is a massive industry in India, right? So if things work out as they have been planned, it can be as big and as massive. Of course, as Ben was alluding at in the beginning, right? Health has a huge element of offline, which payments obviously didn't have to go through. So it might not be as smooth or as fast as UPI, but yeah, I mean, it definitely has all the elements to be big and massive. So we are bullish on it. It's still early days. It's still getting rolled out, and once it gets rolled out, the founders have to first figure out how to benefit from it, and that's when the investors come in, that how to back those founders. So we are some time away, but it sounds quite exciting to us.
Anirudh, let me just come to you. What Abhishek said, one is the offline component for health. But the other point is also in terms of the data integration, data flows across all the various players in the ecosystem. Your health tech companies, insurtech, hospitals, all of it. Can UHI really address this pain point?
Sure. So, from our perspective, whenever we see something big happening in healthcare or healthcare finance in India, typically, in order to try and maybe predict is a very strong word, but try and figure out how it might pan out in the future, we look at systems in the US. Largely because, at least in the healthcare financing space, in insurance, most of what we have in terms of systems and processes were borrowed from the US or were modeled on the US, even though our population sets are very different. So if you go back to, just after the Great Depression, that's when most of these systems were laid in place. And then slowly over a period of 60, 70 years, they evolved. So essentially what you're looking at is what happened perhaps 60, 70 years ago. It's just that evolution or the time it took to evolve is going to get massively crunched in India. We tend to leapfrog tech generations. So it's not going to take 60 years. It will probably, I don't know, maybe take 5 or 6 years. So now what does the health stack do? The health stack does 3 or 4 things. One, it's a central repository of people's health data. Now, health data comes from multiple sources. It comes from caregivers, people who are in health services, hospitals, caregivers, doctors, clinics, etc., etc. There is data also available from and to insurance players and other financial players. And third, this data is also populated by alternative firms, so people like e-pharmacies and so on and so forth, who have come up in the last 5 to 6 odd years. So part 1 is data repository. Part 2 is to make that parts of that data accessible to those who need it for a particular functional need. Now, if an insurance company needs access to people's health records in order to create better products and help them price them better, then they will get access to that. The only challenge there is that data becomes significant when it reaches a certain scale. So for an insurance player to be able to accurately price a particular product, they need morbidity at a population level. Currently, we use morbidity tables. But if stuff like this becomes available over the next 4 to 6 years, then definitely what's going to happen is that financial products in healthcare will become a lot more affordable because then your pricing isn't dependent on some of the assumption factors that we typically consider. The second thing that will happen purely from a pricing point of view, there's a lot of fraud that happens in the Indian healthcare system. Our estimates is that could be anywhere between 12 to 15% of total claims. That's a large amount. For us to prevent all of that leakage, we need some policies, rules, and regulations in place along with the repository. So our hope is that as the repository comes up, there will be some guidelines that will be put in place, just like it happened to Aadhaar and UPI. If both the things happen in tandem and people generally participate wholeheartedly and contribute with that data, then 4 to 5 years, you could see this getting to the same scale as perhaps the US took to get to, maybe over 60, 70 years.
Yeah. Thanks. Ruchira, good to have you back. Can you hear me? We had lost you initially.
Yes, I think you lost me in the introduction. Technology has not been my friend today. Apologies for that.
Yeah, you can just take a quick a minute for introduction, and then I can just maybe sum up what some of the key points that we discussed so that we can get your perspective too.
Thank you, Joji. So yes, I was talking about IFC being the private sector investor for the World Bank Group, and that we do almost about $30 billion in investments globally. Within Asia, that number is about $6 billion. I lead the disruptive technology practice for South Asia, which means I do early stage tech investing and VC fund investing. I also run the global health tech business, and I look at emerging digital models across healthcare in emerging markets. And we typically go in Series A and later. And our check sizes are anywhere between $5 million to $40 million. So that's a little bit about what IFC does and what I do within IFC. But yes, Joji, would love to hear what my co-panelists have been saying. And if there's any way for me to add to that, happy to do so.
Sure. Let me just sort of summarize. Like, we were discussing how sort of started off by saying how we were discussing how COVID has sort of put the focus back on India's sort of creaky healthcare infrastructure, which has been sort of hobbled by issues of accessibility, affordability, and availability. And India allots about 1.26% percentage of its GDP on healthcare spending, which is very low. So when it comes to the quality and accessibility of healthcare, India's rank is also very poor. It's about 145, ranked 145 out of 195 countries, according to Lancet's Global Disease Burden Study. So in that context, I just want to ask you, despite all of these challenges, don't you think that thanks to a convergence of factors, right, India has a rare window of opportunity to leapfrog on health, just like it did in telecom and in banking? And the government is also increasingly looking at offering digital services to act as a force multiplier. And we're seeing a lot of startups come up. So just want your big picture view on this.
Definitely. So I agree with everything you've said. And I think COVID-19 just taught us in a very, very harsh way how little we know about the human body. And despite years and years of advancement in medicine, how helpless we can be in the face of a disease like the coronavirus, right? So it taught us it brought an immediacy and urgency to the issue of healthcare. Access, affordability, and quality, all three pieces of the puzzle need to be solved for. And I think it has lent this urgency to the matter where all stakeholders, investors, entrepreneurs, regulators, academic bodies, industry bodies have come together to make it happen. And I think this, therefore, presents the best opportunity, like you said, for India and several other emerging markets to then leapfrog, because I do believe that emerging markets will never be able to create enough number of hospitals, enough number of doctors and nurses to solve the huge sort of requirement for medical care services across their large population bases. So technology can be that lever to help them leapfrog. And I think all stakeholders are playing their part. Regulation is certainly acting as a very favorable catalyst in making that happen. So the time is ripe. And we're seeing that in the nature of solutions we are seeing. Teleconsultations is a very simple solution when you think about it. But it did become more front and center during COVID-19. Before that, people would have thought of teleconsults and said, okay, that could be my last resort, or that I would use only for a second opinion. But when you found patients struggling to get into a hospital or just not feeling confident about walking into a pharmacy, that led to teleconsultations. It led to e-pharmacy platforms gaining a lot more volume and traction. So it gave a big boost to tech interventions in the healthcare space. And I think the time continues to be now to do more in business creation and funding for health tech.
Yeah. Thanks, Ruchira. One additional question to you, and this is something that the panelists had pointed out earlier, that tech alone can't be a solution. India has a shortage of, some reports say, close to about 7 million healthcare professionals. What do you think can be done to address this gap?
So yes, I think tech alone will not be the solution, but tech will be a huge enabler, and tech will bring together the stakeholders and enable more collaboration. And we can talk more about that separately. But to your specific point about solving for medical talent, and be it
physicians or nurses, etc., I think tech can play a role in being the training platform, because a lot of medical education still continues to be highly offline. And there needs to be tech platforms that solve for medical education. And we've seen that happen in K-12, we've seen that happen in higher education. Now that should start happening in professional degrees and vocational training and the like. So whether it's training a radiology technician or a phlebotomist or a nurse or a doctor, or even the more advanced master's programs for doctors, those things can be delivered through tech. Tech also allows for more hands-on training. We are looking at a platform that uses AR, VR technology for digital scrub-ins into an operating room. So think of using virtual reality to train surgeons and the supporting staff in an operating theater. So that's the kind of power that technology will bring to bear, in which I would say does not nowhere replaces the doctor or the physician, but ends up augmenting capacity, helping them train better and train faster, and therefore increasing the resource capacity.
Got it. Before you had joined us, Ruchira, we were discussing the regulatory challenges. And Ben, let me just come to you for a quick question on, we heard from the others on in terms of the regulatory challenges, but despite all of that, how do you see the ecosystem in India especially? Do you still see loads of startups actually trying to push the limits, be it on product innovation, be it on offerings, be it in building niche products and solutions catering to very specific segments of the population, and also sort of building out larger companies into, like, big ecosystem plays? How do you see the situation?
Yeah, we're seeing companies trying to address this problem in different ways. So one way, of course, is like what Anirudh is doing, which is trying to come up with more innovative health insurance offerings, and more bite-size premiums. That is one way. The other group of startups that we've seen are startups that are offering integration platforms to integrate the hospitals with the insurance providers and with the patients. And you talked earlier about the healthcare stack. There are companies that have been trying to do this as startups. So once the healthcare stack comes up, I think that will accelerate this whole trend and make the whole process of claims management a lot easier and a lot more seamless. And then, of course, there are companies that are trying to build IoT devices that help with people's health. So there are a lot of people. And then the fourth category is what Ruchira alluded to, which is the education piece of it. Startups that are trying to use technology to accelerate education, not just for MBBS, but also for nurses, for healthcare paramedicals, etc. And yeah, so I would say there's a fifth element of this, where we are seeing startups that are building technology layers to make hospitals more customer friendly. So, for example, companies like IU Health, which we are investors in, have taken the second tier hospitals, created a network of hospitals, and put that technology layer on top of them that makes them more accessible to customers. So different types of innovation across different spaces. But I think there's a lot more work to be done.
Got it. I just want to shift gears a bit and just spend a couple of minutes looking at the gig economy in India. That's a huge segment, because while India is always known to have a large pool of informal gig workers, primarily maybe in sectors like construction, the last couple of years, with so many unicorn startups coming up, the country's labor force has made big shifts to gig economy jobs, which is the on-demand, full-time or part-time jobs that many people do. And the potential for this sector is also huge. Some reports have predicted that India's gig economy could triple over the next 3 years to about 24 million jobs. This is just in the non-farm sector, from about 8 million jobs currently. But the main issue for this large segment of people is that they lack social security benefits. They have challenges when it comes to paying their medical expenses, and even like maintaining their livelihoods. Ruchira, let me just start with you first. For gig economy workers, and even for the India's rural population, what is the potential for virtual first health plans in India? Or is it sort of too early? because such plans can offer up, potential to have really low premiums. It can offer greater convenience in sort of where people first visit or see a virtual primary care provider as the first point of care. And do you, going forward, do you see a lot of companies, startups, everybody being interested in this space?
Yes, I do think that has to be solved for, and in a manner that's different than how traditionally health insurance for employees has been addressed, right? So there have to be path-breaking solutions, and one option is the option you're talking about, which is do some kind of group health insurance for employees of companies which are gig economy employees. So they're contract workers, they're sort of daily workers, and have them visit a virtual clinic or a virtual facility before they go to a physical facility. I think that could definitely work. I think both employers and employees would be open to that, especially since these gig workers sometimes are the category that don't have a particular location of work. They could show up at a different location every time, right? And so they may need medical attention at a different location on a different day. So that could work. Also, I would say a health clinic within a factory sometimes is the answer, where you have a small sort of center within a factory location or within a field location, and then that becomes a triaging location, and then finally the person goes to another facility for further attention if needed. But to your solution, to your question about technology, we are seeing technology platforms that are for the gig economy workers, where it's not just about finding a job, but it's finding a job and then continued training. It's health insurance management. It would be payroll management. It's a sort of bouquet of services meant for the gig economy worker, and health insurance is a key component there.
Got it. Abhishek, at Sequoia, you see like loads and loads of deals in terms of startups trying to build innovative solutions for the gig economy sector, both health tech, insurtech, and other areas. How big is the opportunity, and what's the deal flow like?
Yeah. So, Joji, I mean, the way we think about gig economy is basically there's a formalization of labor force happening in a way, right? As Ruchira was saying, as these guys become part of this formal economy, they should get access to all the services and products which any other segment of a white collared, let's say, employee gets, right? Starting with access to healthcare, access to insurance, and so on, right? So from that perspective, I think the step one, which is the formalization, has happened, and we are invested in a lot of companies which are sort of backing that trend, be it Zomato, who obviously has thousands of gig workers, or Apna, which works with these blue collared labor force and helping them find jobs and so on and so forth, right? So I think the step one trend has happened, and now there are companies which are going after this gig economy workers and trying to offer additional products and services, which I just touched upon. For example, Plum, which is not going after SME, which is not going after gig economies, but going after SME population, which is somewhat similarly in Kuala in Southeast Asia, right? So yes, the opportunity is massive. I was reading a report in up till 2019 or 2020, 60% of healthcare expenses used to happen out of pocket in India. Assuming that number hasn't changed too much, it's very high. The world average is at 20%, right? So, and 80% globally is covered by insurance, and only 20% comes out of pocket. Whereas that number in India, 60% comes out of pocket, and 40% is covered by either government or insurance, right? So it's a very high number, and all of these trends will help us get to that world average. It's a very interesting sort of times. So lots of companies are going after this opportunity. We're seeing a lot of companies, we're backing a lot of companies, and hopefully, as I said, it's good for the country, right? If and along with the ecosystem, if these companies succeed and become massive.
Got it.
Joji, I'll actually jump back in because Abhishek made a very important point about, when we are formalizing these workers, the other thing that has traditionally happened is companies have usually, or at least in the past, not cared enough about the contract worker as much as they've cared about the worker that comes into the office, right? So that shift is happening because with a lot of platforms requiring large number of gig economy workers, it could be delivery people, it could be warehouse workers, companies know what the price of attrition can be. And giving a good quality health plan creates that worker loyalty. The worker feels more cared for and also goes a long way in enhancing worker productivity, which is also very important in this space. So I think people are starting to see the benefit of that, and that these will become more ubiquitous.
Yeah, thanks, Ruchira. Ben, just related to the same thing. Last year, India passed the code on Social Security 2020, sort of to formalize the unorganized sector or the gig sectors. But this is yet to be implemented. We've always had a scenario in India where companies, investors all suffer because of ambiguous policies, late implementation, compliance, and all of that. In that context, the uncertainty around the code and its implementation, how much do you think that will hurt both not just investors and startups, but also the lives of millions of people that are who are the gig economy workers?
Yeah, well, Joji, this is an issue that hasn't been resolved anywhere in the world. If you think about it, it's also a big debate in the US, where the California government is trying to decide whether Uber drivers are full-time employees or are they contractors, and whether they should get benefits as full-time employees. And there's a fundamental reason that this has not been, a solution has not been arrived at here, because the fundamental business model of the gig companies is that they are contractors. They do get a choice to work whenever they want to. They don't come in full-time. They choose their hours. And so if the company had to provide them with benefits, then the cost of the employee, of the gig employee, would basically destroy the business model. And bear in mind that no gig economy company in India, at least not that I'm aware of, is actually running a profit. They're still basically growing on investors' money. And so the reason this code has not been implemented yet is that you don't want to kill the goose that lays the golden eggs. If you start putting too many costs on the companies and kill their business models, then these gig workers may not have jobs in the first place.
Yeah. Anybody else wants to add on this, especially the code, the Social Security Code 2020? How you see it? Okay, if nobody is taking it, Anirudh, let me just come to you specifically. As a startup, when you look at both health tech and insurtech, even globally, there are not many companies that are sort of trying to do full-fledged, provide full-fledged health tech services along with an insurance option. When you look at markets like India, do you think the integration of micro insurance plus health tech offerings such as tele services is very suited for an emerging market?
So, see, this sort of an integration is suitable for any market, emerging or otherwise. It's just that micro insurance has a certain connotation and definition. Now, perhaps what India needs is a basic full-fledged coverage, and I say full-fledged, reasonably full-fledged coverage for an overwhelming majority of the population. That's the first thing that is required. That's the most basic thing. So if you look at all other countries, there are different models followed everywhere. In the US, there are systems where the private sector takes care of it with government backing and processes and systems. In the UK, the government takes care of social welfare through NHS hospitals and so on and so forth. Perhaps the only places where this sort of a system works in great harmony and people are really happy about it, etc., is in Scandinavian countries. Population pressure is not that much, tax rates are high, and generally people are happy, and the level of quality of healthcare that's there is out of this world. Now, we are very far from that. Our problems are unique. The population pressure that we have is tremendous. The government has like a million other things to do just because of, the pandemic didn't just throw up problems in the healthcare sector, it threw up problems everywhere. And to expect that the government will come and solve every single problem, it's not going to happen. So yes, we certainly need an integration of tech with financing systems. Our opinion is that those financing systems, I mean, micro insurance and sachetized based products, etc., can come later as a top up or in some certain niches. But you need to work towards something that is far more universal first, so that a large percentage of the population at least has what we call catastrophic cover, a basic coverage. Then on top of that, you can build it. To deliver this, you will certainly need tech. Things like telemedicine, etc., is definitely one part of it. About half of all out-of-hospital expenses is on medicines alone. To store medicines, deliver them, last mile, and so on and so forth is a tremendous task. It can't be done by maybe 2 or 3 e-pharma companies alone. So if you ask me, this sector perhaps needs participation from at least 30 to 40 more companies operating at scale, both insurance-based as well as non-insurance-based.
Got it. Anirudh, quickly, for startups like you that are building such solutions, apart from tech, what are the other challenges? Is it lack of adequate investor interest, or is it the regulatory framework, which we discussed earlier, or is it the reluctance for the users to pay for such offerings?
So it's a bit of quite a few things. I mean, there's no one big issue. Perhaps the biggest of all would be infrastructure. Infrastructure in terms of data availability, especially for people who are financing a transaction. We're people in insurance who create insurance products are very similar to people who create lending products. So before you give someone money, you need to know a lot about them. It's the same thing that happens in health insurance. Before you give someone a cover, you need to know a lot about their medical state and their family, etc., etc. So that's part one of the challenge. Data is not available. Second part of the infrastructural challenge is something that I alluded to before. So, as you stated early on, out-of-hospital expenses in India is about $300 billion. God knows how many people go untreated, and therefore that number doesn't even get captured. But if you look at the $300 billion pie, half of that would be just medicines alone. And if you think of what does it take for a medicine to go from a manufacturing facility of a pharma company and finally to reach a person's home, there's like complex logistics involved, from warehousing to retailing to last mile logistics and so on and so forth. To do this at a national scale and at a crunched timeline, it's going to take a lot of capital. It's also going to take a lot of smart people to create solutions that haven't traditionally been thought about. You can't build pharmacies everywhere. So infrastructure, in my mind, different types of it would perhaps be the biggest challenge. And then there are things like regulatory, etc.
Thanks. Yeah. We have only a couple of minutes. I just want to touch upon one or two things. Ruchira, let me start with you on this. One thing that sort of receives very little attention in most emerging markets is mental health. And especially if you go outside the big cities, there's hardly any infrastructure or even sort of people, trained medical staff who can, or mental health providers. Do you see this as an opportunity for startups? And also, apart from mental health, the other thing is health tech for women. Even that there is very little focus on. So on both these, what are your views?
Let me start with the latter, because we spend a good part of this year on that, on the health tech for women. And for those who may not be aware, IFC ran in partnership with the CES conference, the Global Women's Health Tech Awards. And we invited applications from companies, not just startups, even scaled assets. So it could be said, you could be anywhere in the revenue range, but if you are providing a solution that solves for women healthcare in emerging markets, you can apply. And despite the fact that various countries have different waves of COVID still going on, which affected the interest. We got a huge amount of interest, a lot of applications. We are currently in the process of shortlisting them and we'll be having jury sessions through the rest of this month and early next month. And then the winners will be announced at the CES conference in January in Vegas. And that is, we did that. We did that primarily because I agree with you, Joji, that this is a sector, a space that has been ignored. While people think of healthcare as one big space, within healthcare, women tend to be at a disadvantage when we talk about access to care or affordability or the quality of care that they get. And their needs often tend to be unique, and somehow the solutions that are presented to them are quite generic. I'm given to understand that most drugs as well, clinical trials get done largely on male populations. And then those drugs are made available to women to use for the same disease, and their bodies might react differently. So things like that, to cancers that are women specific, like breast cancer screening. And, we are still using the age-old modality of mammograms. Can there be smarter solutions? And we are in fact exposed through our investment in Pi Ventures to a company called Niramai that uses AI layered on thermoanalytics for smarter and more accurate breast cancer screening. So solutions like that will help solve, to some extent, the huge problem of women's healthcare. And I should quickly mention there are also things around women's security and safety, which are a big issue in India and other emerging markets. The second point you raised there was on mental health. Yes, I do agree it's a big opportunity for startups, and I'm seeing that happen. I mean, I'm seeing a lot more mental health startups come and pitch to us. A lot of them are bot first. So it's basically a an app solution where based on the user's responses, the app does sort of a first level support to the user. And then if a next level support is needed, it connects you to an offline psychotherapist or counselor. We will see that becoming more present everywhere, because there used to be a societal stigma on acknowledging that somebody had a mental health issue. I see that going away. Everyone unabashedly admits that we are stressed. Our lives are becoming busier. There's so much to be done. We're all on an endless race, and that brings some level of mental pressure to everybody unsparingly. And then there are some of those to whom it affects more than others. I mean, COVID-19 has put so many people into depression and mental stress. So I think huge opportunity for startups to come in. Initial models that we are seeing are omni-channel. So there will be a tech play and an offline play. Going forward, I think tech will become increasingly more present. Only this morning, I was speaking with a company that's building digital twins sitting out of New Zealand. So soon you may find that your best friend is actually a digital entity at some point in the future. And so the psychotherapist could easily be a smart AI-powered digital entity. And we have to get there. But I think in the near term, hybrid models, great opportunity for startups.
Got it. Ben, just a related question to you. If you look at data, mental health startups in India have hardly raised or got any funding. It's just 20 million over the last 4 years. Is scaling the biggest challenge when it comes to mental health startups?
Yeah, so I think, to Ruchira's point earlier, women's health and mental health are both big areas of focus for us at Vertex. On mental health specifically, what is required in India is our hybrid model. It has to be an omni-channel model. A bot-only model will not work, in my opinion. And the reason being, the culture in India is more reactive as far as this is concerned, rather than proactive. And in the US, people are used to going to therapists even when they feel slightly depressed. Here, most people react once they get a breakdown. So we have to have anybody who's trying to build a business in this has to do it omni-channel from day one. A bot model will not scale, in my opinion.
Got it. Abhishek, slightly on a different track, when it comes to both, you mentioned Zomato earlier. So when it comes to both health tech or insurtech solutions, for long we've been talking about the global big players like the Walmarts, the Amazon, the Apples, and the Googles, all of them sort of reshaping the space. And the equivalent of in India could be your Flipkarts, your Olas, your Zomatos, and all of them have a fintech arm. Many of them have an insurtech arm. Do you see many of these companies, the unicorns, becoming full-fledged players in this space?
Joji, that's a tough question. Like, it's hard to say whether they will become or not. What I can tell you is historically, unlike, let's say, China and Southeast Asia, we haven't seen true platform companies emerge in India. For example, like GoTo in Indonesia, like it's big across all verticals. Whereas in India, for example, in food delivery, Zomato and Swiggy are the clear market leaders. In terms of taxi, we have Ola and Uber, right? So different verticals have different market leaders, and we haven't so far seen a true, like what we call as a platform company in India, unlike, as I said, China and Southeast Asia. So that being said, that doesn't, I mean, history is not a reflection of the future. So it's not impossible that, I mean, I'm sure we are all seeing lots of ads from PhonePe right now, trying to get people into insurance space. So, of course, there'll be attempts, and some of those attempts might be successful. But net, at least my personal view is that irrespective of how these companies approach this, they will get some market share, but there'll always be independent leaders who are solely focused on solving the issues in this space, right? So, for example, in insurance, we already have the market leader being Policybazaar, which went public today. Similarly, there'll be other players who will be solving different aspects of insurance, and these players will coexist with platform companies like Flipkart and the other names you took. So yeah, that's our view.
Cool. We are past our time, but just requesting all to stay in for 5 more minutes so that we just want to cover maybe one more round of quick questions. Anirudh, just adding on to what Abhishek said, do you see startups like you actually riding on the Olas and the Flipkarts or the Amazons or Zomatos, or where you just focus on the tech and ride on the platforms for distribution?
Absolutely. That's an asset-light approach. Works well for us. If someone's done the hard work of getting to a person who was otherwise not reachable, then I mean, it's just common sense for people like us to ride on the back of that work. So there used to be, I mean, and this is not a totally new model. So earlier when ITC would reach a remote village somewhere, other things would be distributed on the back of that distribution mechanism, which ITC or Godrej or some other consumer company had set up. So it's a great way for us to, and that's exactly what we are doing, at least in the retail space.
Sure, thanks. Ben, SaaS is perhaps the hottest sector in the country in India currently. For investors like you, when you look at companies, for example, in the health tech or insurtech space, can you look at these as a subscription businesses, like a SaaS model?
SaaS by definition is a subscription model. I think insurance, if you're looking at insurance as a subscription, the question then becomes, and this is for the insurtech companies to answer, are the margins sufficient to overcome the cost of customer acquisition? Because what we've seen with the insurance is that it's very much a push, particularly health insurance, it's very much a push-based model. And if you look at Policybazaar, which Abhishek just mentioned, they've got a call center of 4,000 people that calls people and tries to convince them to buy insurance. So if the margins can be sufficient to overcome the CAC, absolutely, it can definitely be a subscription model.
Yeah. Just one last question each to all the panelists. Ruchira, a big picture IFC, what's your road ahead for 2022? Do you see yourself doing more investment in funds or direct investments?
We will continue to do both. Both are critical elements of our core business. But the thing with direct is we are very excited about the role IFC can play in our direct investments, because we are active on the board. And a lot of these business models are going beyond the country borders and becoming regional plays or global plays. And that's where IFC plays a very big role in taking successful businesses across emerging markets. So I think continued focus on both. I would emphasize the role we can play in making companies regional and global because of our strong emerging market presence.
Got it. Abhishek, one point that we didn't discuss for all of these startups across sectors, including health tech, insurtech, and all of that, how much of a role has the smartphone penetration in India played? And India also has the cheapest data rates in the world. And with 5G is supposed to come up, do you think that will be a big game changer in reshaping health tech, fintech, insurtech, all of this for in an emerging, especially for the emerging middle class in a country like India?
You're right. Like last 3-4 years, you can call it the geo effect. I mean, we have seen hundreds of millions of people becoming part of the internet economy. For most of these folks, they start with WhatsApp. That's for them. That's internet. That's where it ends. But as they sort of start spending more time, they progress to other products, and obviously health is a very important element in their life. So they are starting to we are starting to see the the new segments of population accessing health tech. So yes, I mean it is already. I mean the point you mentioned that we have the cheapest data rates, the handsets, the smartphones are. Population has access to cheap smart phones is been a massive catalyst to the whole ecosystem, including health. 5G is going to only further accelerate it. For the same cost, people are not going to get access to high quality data or fast data. So things like video conferencing or online consultations should become much easier for this new set of population which has joined this whole internet revolution. So yes, it's going to be big. Now, how big it is going to be, again, like it's hard to crystal ball gaze here, but it's going to definitely add fuel to the fire. We are already growing fast, and this will make it faster if possible.
Yeah, Ben, let me end with you. The funding boom India has seen this year. In 2021 alone, like I think startups have raised about $20 billion in funding. We've had about 36 new unicorns in India just this year alone. So flush with funds in the digital economy, can startups revive India's economy?
Well, it's great that all this money is coming to India, and it's definitely will help the Indian economy. I think what I certainly hope happens is that these startups will take this money and build profitable business models, because at the end of the day, you have to make money at some point. And I worry about some of these startups are burning so much cash, but raising money is so easy that they're not under pressure to turn profitable anytime soon. It's all very well to grow, and you have to go after growth, but you also have to have a model that turns profitable at some point. And when you have public companies that are losing money with no path to profitability in sight, that becomes worrisome. Yep. Hopefully my worries are unfounded.
Yeah, apologies. We have run out of time. We can't take more questions. We're already 7 to 8 minutes beyond our scheduled time. To all our audience, subscribers and readers, thank you so much for joining us. A special thanks to our panelists, Ben, Ruchira, Anirudh, Abhishek. Thank you for the great, insightful discussion. We should have both the transcript and the video mailed across to all our audience by early, either later this week or by early next week. Thank you once again for joining us. It was great to have you all, and we hope to see you on November 30th for our next webinar. Thank you.
Thank you. Thanks, Ajay. Thank you.
Thank you.